My name's Jago Taylor. I'm the Benefits Realisation Lead for clinical dashboards. I've been involved in shaping the benefits work both from a program perspective and also working with the individual trusts to generate their local benefits case. Clinicians tend to find clinical dashboards a really useful tool for a number of reasons. The main one is it allows clinicians to take a leading role in defining the most important information and requirements for running their service, and in doing so they understand better what really drives improved performance of their service and also drives improvements in the underlying data quality. So they're perceived as a very useful tool. They need to be really driven from a clinical engagement perspective, so clinical buy-in and leadership is absolutely essential for clinical dashboards, and we're finding that by clinicians taking a lead, they're actually focusing on the things which are important to drive improvements in their service and also improving the underlying data quality of the source systems and information that's available. The benefits for clinical dashboards have been defined locally as part of the local business case for clinical dashboards, so it's very much a bottom-up process. Actually the process of selecting metrics that go on a dashboard in itself help to define the very specific benefits which are very independent to each of the individual dashboards. So for instance, some clinical teams may focus on certain areas such as length of stay, etc. And the reason why they choose these areas is because they think they can influence them and they want to get a better understanding of these drivers, if you like, so that they can then influence and control them. So the way I look at it, the first stage of a clinical dashboard project is to identify the key clinical outcome measures, if you like, and then once you identify them, then the dashboard allows you to monitor these drivers and get a better understanding of how you're performing, and then that then leads to an opportunity to be able to improve these underlying drivers. And so it's really a matter of understanding and measuring what you want to influence, and that old adage is true that you can't manage what you don't measure, and so this clinical dashboards has been powerful in terms of getting clinicians to really help shape and define what the key drivers are for their services. The benefits we've identified locally for clinical dashboards has been a very interesting process. There tends to be two different categories of benefits from a high level. One of them is a set of common benefits. These are common benefits that we're seeing across all dashboard projects, and some examples of this would be improved underlying data quality by actually looking at the information that's available and then seeing where there are problems with it and resolving it. Similarly, the dashboard itself as a tool, it's an enabler of improved decision making. It's not the solution to that. So by clinicians looking at looking at their service and defining the measures, and by actually monitoring them, they're then allowing themselves to make better informed decisions to improve those services. But I think the key point is that the benefits themselves will not come from just having a dashboard. The process needs to be a continual improvement process where the measures and what you're monitoring is then influenced and changed over time, and you really need to have a service improvement view of the world in order to really realise the major benefits. And some of the benefits we've seen, like I said, they're very much either common or dashboard specific, and the dashboard specific benefits are very much tied into the metrics that have been selected. But the type of thing where we've started to see that's come out of the dashboards we've implemented, in primary care, for instance, the sharing of data between the acute hospitals and the GP surgeries has allowed the GPs to identify kind of at-risk patients, the patients that are attending A&E services out of hours frequently, and quite often the reasons for these attendances quite easy to solve, and unless you know who these patients are that are attending frequently, you'll never be able to manage those patients. And it's really quite powerful, that sharing of information, which is already available, but between organisations, which has allowed GPs to highlight their patients or groups of patients which are attending too often, for instance, and being able to work out why that's happening and then preventing it. And that obviously has a massive productivity impact to the NHS as a whole, because these attendances, they're all taking up resources, and in many cases they could be avoided.